Hi, this is Steve Worona, and you're listening to Campus Public Safety Online from the National Center for Campus Public Safety. Before I introduce today's speaker, here's a brief orientation to the Adobe Connect interface we're using. Your browser right now is showing the title slide for today's talk. On the left side of your screen, you'll see a box labeled Questions and Comments where you can read and type messages. There's a tab labeled Everyone at the bottom of this box, and that's the tab you use for all of your general messages, including questions and comments for our speaker. We'll be breaking for questions several times during the presentation, so please do not hold your questions to the end. You can also send direct messages to a specific person by hovering your cursor over a name in the attendee list. And one of those names is Technical Help, and that's the place to go if you run into technical problems. We're also monitoring Twitter for your questions and comments. Use hashtag NCCPSWebinar, NCCPSWebinar. If you miss part of today's conversation, or if you want to see some or all of it again, this webinar is being recorded and captioned. The link will be available shortly after the webinar on the NCCPS Webinars page. And watch your email for a link to a brief evaluation survey requesting your reactions and comments on today's session. Please take a minute to respond to that survey when the link arrives. We do appreciate your feedback. And now for today's presentation. Eliminating sexual violence on college campuses requires a comprehensive approach to primary prevention based on the best available research evidence. The Centers for Disease Control and Prevention, working with federal and local partners, is committed to advancing the science of sexual violence prevention to inform the development of more effective strategies. Dr. Kathleen C. Basile is a key CDC researcher in this area, and she's with us today to provide an overview of the latest knowledge related to sexual violence, including the need for comprehensive, multi-level approaches that address the complexities of this problem. Kathleen is a senior scientist in the Office of the Associate Director for Science, Division of Violence Prevention in the National Center for Injury Prevention and Control at the CDC. She's been at CDC since 2000 and focuses her work on the measurement, prevalence, risk and protective factors, evidence base for prevention, and health consequences of sexual violence and intimate partner violence of adults and adolescents. She has authored or co-authored more than 80 presentations, journal articles, chapters, reports, and other publications. She has guest lectured annually at Emory University since 2004 and has received several awards and nominations for her work in public health. Dr. Basile received her Bachelor of Arts degree in Sociology from Alfred University in Alfred, New York, and her Master of Arts and Doctorate degrees in Sociology from Georgia State University in Atlanta, Georgia. Kathleen Basile, welcome to Campus Public Safety Online.
Thank you. Okay, I'll begin then.
Yes.
All right, let's start with an overview of what I'll be covering in this webinar presentation. I'll just briefly cover our definition of sexual violence that we use at CDC and some prevalence data on sexual violence. Then I'll move to the risk and protective factors for sexual violence. I'll review the prevention research, what we know works to prevent sexual violence. Then I'll talk briefly about our technical package that CDC released earlier this year to prevent sexual violence. And then I'll end the webinar with some information about the importance of a comprehensive, multi-level strategy to prevent sexual violence, and then some examples of some innovative products or projects that are going on in the college context. Okay, so a little bit about definition and prevalence. I want to start with the definition so we're all on the same page as to what CDC includes in its definition of sexual violence. So sexual violence includes a sexual act that is committed or attempted by another person without freely giving consent of the victim, or when the victim is unable to consent or refuse. For example, in the case of being unconscious or under the influence of alcohol or drugs. So these are the components of sexual violence here on the slide. Penetrative acts that may be forced or in situations where alcohol or drugs facilitated the penetration, and then penetrative acts where it's not physically forced, but there may be some non-physical pressure or intimidation. That's what we typically call sexual coercion. And then intentional sexual touching, fondling, groping, things of that nature, as well as non-contact acts of a sexual nature, such as showing pornography, flashing, or exposing oneself to someone. Those are just examples. Now, sexual violence can also occur when a perpetrator forces or coerces a victim to engage in any of these acts with a third party as well. So if you're interested in more about the definition, the citation is there at the bottom of the slide. So a little bit about prevalence. This is some data from CDC's NISVS, which is the National Intimate Partner in Sexual Violence Survey. And this is an ongoing nationally representative telephone survey of adults, so ages 18 and older. This survey began in 2010, and it's an ongoing survey that provides national and state-level data on both lifetime experiences as well as experiences in the last 12 months with sexual violence, as well as intimate partner violence and stalking. And so what we found in the most current year that we have published in 2011, we found 1 in 5 women and 1 in 59 men experienced an attempted or completed rape. That's a lifetime. These are lifetime estimates. 1 in 15 men reported being made to penetrate someone else. 1 in 8 women and about 6% of men reported sexual coercion. And then about a quarter of women and 1 in 9 men reported unwanted sexual contact. And about a third of women and about 13% of men reported non-contact. So that's the national prevalence that we have most currently. Moving to early experiences. So we know from the research on sexual violence and rape that this is largely what has been called in the literature a tragedy of youth. So we know from our NISVS data, this is data from 2010, that and this pie chart is showing among female victims of completed rape, more than 1/3, more than 3/4 of victims were first raped before their 25th birthday. So that's combining the blue, the dark blue, the green, and the red pieces of the pie. And almost half experienced the first completed rape before the age of 18. So that's the dark blue and the green together. Particularly relevant to this webinar group, we know that more than 1/3, and that's the red area, 37.4%, first experienced completed rape between the ages of 18 and 24. So that's the college ages. So that's some evidence that we know this happens early in the lifespan if it does happen. Moving to risk and protective factors for sexual violence. So some of my colleagues here at CDC conducted a review a couple of years ago on risk and protective factors for sexual violence perpetration. They were focused on what puts one at more risk for perpetration and what protects them from perpetrating sexual violence. And the goals of this study were to identify these empirically based risk and protective factors, to compare them across different studies with different samples and different ages and developmental phases, and then with the idea that that would inform developing evaluation and developing interventions and evaluating them to prevent sexual violence. So they reviewed 191 studies and identified many factors at different levels, and I'll get into that more in a minute. This was what they found in the studies that they identified as most of this work was focused on male to female sexual violence, so male perpetrators against female victims. And much of the work was in college settings. So this is what resulted from this work. This is the publication. It came out in 2012. And if you go to that link, there's a summary of the findings, and you can find the report at that link, or at least the summary of the report. Again, this is focused on perpetration. And before I get into the actual findings of this review, I want to share what we use quite a bit in public health at CDC, and this is the social ecological model, and this is just to orient you to what we know about risk and protective factors for sexual violence. So we know that they occur at each level of this social ecology, and this model is reflective of the comprehensive approach to prevention that I'll be talking about shortly. But just to orient you here, there's the individual level, the family or peer level, the community level, and the societal level. Each level is nested in the next level. So What that means is that individuals exist in the context of their relationships with family or peers or intimate partners, and those relationships exist in communities and then in the larger society. So communities can be defined differently. They could be the neighborhood, or it could be a college campus, or however community is defined in the context you're in or in the study you're doing. So I'll talk more about this shortly, but I wanted to orient you to that before I talk about the risk factors. So this slide gives some examples of some risk factors at the individual and relationship levels of the ecology. So the ecology I just shared, we're talking about the first two circles. So results of this review are organized by the social ecology, and based on this, much of what my colleagues found in this review were that most of the factors are at the individual or relationship level. And I think the main message of this slide in particular is that there are many different domains of risk that contribute to sexual violence. So, you know, a lot of studies and interventions and programs focus traditionally on the gender-based cognitions or the norms and attitudes around gender, but there are a number of other domains that are also associated with sexual violence, as you can see from this slide: aggressive behavior, gang membership, and other relationship level factors, history of maltreatment or violence in the home, etc. And so, as I said here in red, a lot of what we know that is out there in terms of programs is focused on these gender-based cognitions, which are important, but which don't tell the entire story of risk for sexual violence. And so other domains are important, and if they are focused on, they may result in a greater impact. So I'll get a little bit more to that later. Moving on to the outer levels of the social ecology, there are some gaps in the literature, and two big gaps that we've identified and are trying to fill currently are around community level factors as well as protective factors. So community level factors are those in the outer levels of the ecology. So beyond the relationship and individual level, this could be neighborhood, this could be college, this could be you know, a district or a county or however it's defined in the study. But we don't, or this review didn't find any consistent community level factors. So this is an area that we're trying to learn more about. In terms of protective factors, so what I mean by protective factors are those factors that either have a direct effect on decreasing the likelihood of perpetration, or what we call a buffering effect, a moderating effect. So it may impact a risk factor and decrease the strength of a risk factor. So we, in addition to the community level factors where that's a gap, we also have a gap around protective factors. We know a little bit about protective factors, and what you see here on the slide are some examples of what we know. Emotional health and connectedness has been found to be protective for high school boys, whereas academic achievement was found to be protective for high school girls. And then there was a study looking at parents' use of reasoning to solve family conflicts. There are very minimal research on this. Oftentimes the risk factors dominate the findings, and so protective factors can't, in a way, they can't compete with risk factors for explaining perpetration. So we're interested in identifying more protective factors or identifying more buffering of protective factors, but we do know a little bit about that, as I have here on the slide. And there are a few studies here at the bottom, or links here at the bottom of this slide, that will give you more information on that review article. So this might be a good place to stop for any questions.
Thanks, Kathleen. You're listening to Campus Public Safety Online from the National Center for Campus Public Safety. Our speaker today is Dr. Kathleen Basile from the Centers for Disease Control and Protection. We're talking about applying the best available research evidence to build comprehensive strategies for sexual violence prevention. If you have comments or questions for Kathleen during the course of the webinar, type them into the line at the bottom of that questions and comments window on the left side of your screen. We've got a couple of pauses planned during the session. We will get to your questions before the end. Kathleen, Ann Frankie wonders, I've heard the assertion that college students are at lower risk of sexual violence than similarly aged people who are not in college. Can you comment?
Yeah, so there are different studies. It really, in some ways, depends on the study. There has been quite a bit of focus on college age and the college environment as being particularly risky for sexual violence, both victimization and perpetration. I think there are some studies, a scholarship out there, several studies that have shown that college is, and particularly the early part of college, like freshman and sophomore year, it is a vulnerable period for victimization as well as perpetration. But I think the point is that it's not to say that it only happens in college. In terms of lower risk in the college, it depends on the study. In my view, some studies have found if you look at college age outside of college, they're at as much risk or more risk. It really depends also on the sample. So there may be some high risk samples that you'll see more victimization at the college age or at younger ages. You know, there are studies around young people who have had a trauma history in their childhood. They would be at high risk for sexual violence whether they're in college or not. And there are other high-risk groups, LGBT or lesbian, gay, bisexual. We know that they're at risk or at higher risk regardless of their college status. We know that they're at higher risk than other samples. So I think that the main point that we try to make is that younger age, adolescence, and starting early with prevention is important because there are lots of risk factors, and particularly risk factors that happen early in life that kind of set the stage for either victimization or perpetration. I don't think it's clear that college versus non-college is lower or higher risk. It really depends on the study.
Catherine wonders, and I think this is picking up on the final bullet that's on your current slide, what family reasoning to solve conflict would you feel affects the teens?
I don't know exactly how that was measured, and that was just one study. So keep in mind that these the information I have under protective factors on this slide are just based on one or two studies that found some support for something positive, having a protective effect, decreasing the risk. I don't know what specifically was measured in this study in terms of parents' use of reasoning to solve conflict. I think there's been a larger research around parenting styles and connecting, feeling social connectedness to your children, or having a relationship where your children will come to you and talk about things. That kind of, it's called social connectedness. Sometimes it's called parental warmth. There are different ways that it's labeled and measured in the literature, but I think the bottom line is that studies studies that are finding that having a positive relationship with your children, a positive parental role model where you feel connected to your parent, has in some studies shown positive effects on either protecting you from perpetration or victimization. In terms of the specific use of reasoning, I can find out how they measured it in that study and let you know if you want to send me an email, but I don't know exactly how that was measured in that study.
And let me squeeze in one more question during this break. Why was there a focus on risk factors for perpetration in the CDC review paper rather than risk factors for victimization, or considering them both equally?
Mm-hmm. So we, of course, they're both important. We at CDC have kind of a niche in focusing on perpetration, mainly because we're focused on primary prevention. So the idea is to try to stop violence before it begins. And so we need to, in order to do that, we feel like we need to start young in the lifespan, and we also need to focus on potential perpetrators or those that may be at high risk for perpetration rather than victimization, because we think that focusing on perpetration will have a broader public health impact. And so from a public health perspective, we tend to focus our limited resources on perpetration. Now, that's not to say that we don't do some focus on victimization or that we don't think that focusing on risk for victimization is important, because it very much is important. But we try to, at least in that paper, focus, and in much of our work, we focus on trying to prevent and learn more about how to prevent perpetration.
Thanks, Kathleen. If you have other questions out there, keep typing them in, but in the meantime, we'll let Kathleen get back to her presentation.
Okay. So now I'm going to move to talking a little bit about the prevention research and another review that some of my colleagues have done. And this was focused on a review of sexual violence primary prevention programs to figure out essentially what works, what doesn't work, what do we know about how to prevent sexual violence, and what have we identified as the gaps. So this is the citation is there at the bottom. These are some of my colleagues at CDC. As I said a minute ago, what we mean by primary prevention is trying to stop perpetration of sexual violence before it begins, so before somebody perpetrates, to prevent the perpetration from ever happening. So this was an evaluation of the literature, and here I'll tell you a little bit more about what was found. So this slide might take a few more minutes than the other slides, but essentially what was found, my colleagues separated this into what's effective, meaning what works, what we have confidence we can say is effective in preventing sexual violence, what's promising, what may work or what might work in some contexts, and then what's not effective. And so these are, on the right side, some examples of programs that were identified in these different categories. So Safe Dates, I'll just very quickly go through these. Safe Dates is a dating violence prevention intervention. It's focused on 8th and 9th grade students. It has 10 sessions in a course. It also includes other things like poster contests, parent materials, teacher training, a play script that the students do. There's lots of different components to it, and it was found to be effective in reducing dating violence, including sexual dating violence. So it is in the dating context, but it does isolate sexual violence in the dating context, and it was found to reduce that. And it has quite a long follow-up period. They found 4 years later that there were still reductions. So we consider that effective. Shifting Boundaries is an interesting study that was done in middle schools in New York City, and it had essentially two parts to it. There was a curriculum or a classroom piece, and then there was a school-wide component. And as you see there on the slide, the building level or the school-wide component was what was effective. And so there was a 6-session classroom course with lots of parts and pieces to that. And then there was the building level, and that had lots of pieces too in terms of posters to increase awareness, temporary restraining orders, students identifying hot spots in the school setting, in the actual physical environment of the school, meaning unsafe school areas that they called hot spots, and that they placed faculty and extra administrators of the school to keep that secure and to create greater surveillance of those areas. And what they found after 6 months was that the curriculum didn't really matter. It wasn't effective, but the building level intervention was. And they suspect it was the hotspot mapping, so identifying these places in the school. So that's an example where they're going beyond the individual and relationship level, and they're looking at the environment and the community or the school level. Real consent, by the way, the asterisks on these slides were studies that were found after the review was done. So if you read the review, they won't include these, but we added these because they were identified later. Real consent is an online, this is for college-age men. It's a bystander and bystander intervention. It has other pieces around changing norms and attitudes around rape, increasing knowledge of what it means to sexually consent, affecting and increasing areas around masculine gender roles. It's a 30-minute web-based, there's 6 30-minute web-based interactive modules. So it's an ongoing thing, and it was found to decrease sexual violence perpetration and increase positive bystander behavior. And I'll get into the bystander information in a minute. So those are the ones that were found to be effective. As you can see, there aren't many. There are 3. Moving to the promising, what we mean by promising is that it may work in some scenarios. It may, for example, second step, the student success through prevention, was effective in 1 of 2 states where it was tested. This is a social emotional skills-based learning for middle schools, where they're focused on emotion management, empathy, learning problem-solving skills. And they found that it was effective in Illinois, but it wasn't effective in the other state, which I believe was Kansas. So that it's promising because it at least worked in 1 of the states, but more research is needed. And then bringing in the bystander and green dot are both bystander interventions, and you may have heard about these. Green dot in particular, both of them actually are pretty well known in the college arenas, I believe. And these are bystander programs. They're designed to impact acute cases of sexual violence where they're teaching people to intervene if you see that sexual violence may be happening at a party, at a bar, wherever it might be, but also to intervene on attitudes that are related to perpetrating sexual violence, like sexist jokes or aggressive comments or attitudes or aggressive comments toward women. And so both of these have been shown to be promising. Green Dot is a 5-hour training. It's over time. They do repeated trainings. And it has been associated with reductions in victimization and harassment and stalking. They're still publishing on it, and it's been looked at both in the college and the high school level, and so more findings will be coming out soon. But we consider it promising at this point. Bringing in the bystanders, similar. It has not been shown to affect sexual violence, either victimization or perpetration, but it has been shown to increase intentions to engage in bystanding. So it's considered promising in our case. And then Coaching Boys into Men is an interesting, innovative program that is focused on training coaches, athletic coaches, to illustrate and model respect and promote healthy relationships with their team, with their athletes on their team. So it focuses on various themes of teamwork, integrity, fair play, respect, et cetera, and it has been shown to decrease dating violence, which had a sexual violence component, but we don't know if it can impact sexual violence only in that dating context. So we consider it promising at this point until there's more research. And so what we know about what's not effective is that the brief 1-session educational interventions that don't have more than kind of one hour session. They're mostly focused on changing awareness, knowledge, and attitudes and belief, but they're not usually effective in preventing sexual violence. So a little bit more about that. In this review that I've been referring to, they've reviewed 93 of these 1-session programs. So it's usually these are about an hour long. They're usually focused on education and awareness, and they have not been found to be effective in preventing. When they look at sexual violence outcomes, they're not effective. And I think there could be several reasons why they're not effective. One is there's what we call an insufficient dose. So there's not enough of the intervention to make a difference. If just 1 hour, whereas the ones that have been found to be effective, they're 5 or 6 or 7, or they're over time where they have sessions over time where they're given enough of a dose of the intervention for it to be able to change behavior. And other things like passive audience, if it's just teaching skills and the audience is listening and it's not as interactive, it hasn't. Those types of those types of interventions haven't been as effective in the literature. And then there may be critical risk factors that are left out of some of the interventions that don't seem to work. So that's a sense of what we know doesn't work. And then I'll briefly talk about the technical package that I mentioned earlier. So using and understanding all the research that I just very quickly summarized for you, we at CDC decided that it was time to pull together a technical package for the prevention of sexual violence. And this came out in April of this year, and there's a picture of it, and you can get it on our website. So what do we mean by a technical package? A technical package is a select group of strategies that are based on the best available evidence, and the idea is to help communities, schools, grantees that we have, public health departments, colleges, any community that's interested in preventing sexual violence, to share information on how to sharpen their focus. What should they prioritize? What will have the greatest potential to reduce sexual violence? So that was our motivation for bringing this together. And there are several benefits of technical packages, and our agency director, so the CDC director, Dr. Tom Frieden, considers these a priority, technical packages. And he outlined in the paper that's listed there at the bottom of this slide why technical packages are one of 6 key components for effective public health program implementation. So not only do they help us sharpen our focus on where to focus for sexual violence prevention or for any type of prevention, they also help us avoid what he called a scattershot approach of using a large number of different interventions, not knowing if they work or not, so some of which may work, some of which may not have as much of an impact or have a smaller impact. So it really helps to sharpen the focus, and this has been a priority in our division at CDC, and we've done technical packages for many of our topics, and we continue to do these. So moving to, if you were to look at this technical package, you'll find these components in it. So there's these primary components. The first is the strategy. So we have 5 strategies. What we mean by strategy is the preventive direction or the action to achieve the goal. In this case, the goal is preventing sexual violence. The second component is the approach. So the evidence-based approach, these are the ways to advance those strategies. So we have 5 strategies and several approaches, a few for each of the strategies. And then under the approaches, we have examples of specific programs, policies, or practices for each of those approaches. And those examples are selected based on the evidence of population-level impact. So we try to either have empirical evidence for the example or some kind of conceptual or theoretical evidence for why we think it may be related to sexual violence. And these considerations were considered here in selecting these programs, policies, and practices. This is what we considered. So we're selecting programs, as I said, based on the best available evidence. Ideally, that would be evidence of impact on sexual violence outcomes. When there was not that kind of evidence, we looked for evidence of impact on risk and protective factors for sexual violence. So things that we know are related to sexual violence, like healthy sexuality, for example, or risk behaviors for sexual violence, with the thinking that if the intervention is related to those, then it may have an impact on sexual violence as well. We also looked at impact on other forms of violence that may co-occur with sexual violence, which again may suggest that it could have an effect on preventing sexual violence as well. So of course we looked at other things like making sure there's no evidence of harmful effects, that there's feasibility in the U.S. context if it was a program that was implemented somewhere else, etc. And I'll share this slide, which is a snapshot. This is essentially all of the strategies and approaches, just in a short summary here, that are included in our technical package. It's important to note that we designed this technical package for the larger field, not just for public health and the work that CDC does, but we were thinking of the larger field of preventing sexual violence. So here you see in green some of the approaches that I thought may be most relevant for your interest in the college context, so I'll highlight some of those here. So the first strategy is promoting social norms that protect against violence. So social norms-focused strategies. And the approaches here are either bystander approaches or mobilizing men and boys as allies. And so again, the bystander approaches, examples that I gave earlier like Green Dot or bringing in the bystander, are the example programs that we gave there because they have some level of promise for effectiveness. In terms of mobilizing men and boys, the example that I mentioned earlier, coaching boys into men, that's an example that it's using male coaches to and training them to be kind of role models for their athletes, for their male athletes. So those are two examples under the social norms strategy. Moving to the teaching skills strategy, there are 4 approaches there. So some of the ones I talked about earlier, social emotional learning, like teaching empathy and anger management and controlling emotions, teaching healthy and safe dating skills, dating relationship skills like the safe dates example, promoting healthy sexuality is an example of an approach where there's not a whole lot of evidence, or there isn't any evidence that we know of directly connecting healthy sexuality to sexual violence prevention, but we do know that it prevents many risk factors for sexual violence, so we do see that as theoretically important. And then empowerment-based training I have there in green. This is some are labeled as not just empowerment, but I'm blanking on what they're called. I'm sorry. There's an example called Enhanced Assess, Acknowledge, and Act program. So it's teaching skills to protect yourself, not just self-defense, which was what I was trying to think of. So they have self-defense components, but there are also components around empowering. These are mostly focused on women or potential victims, empowering them to negotiate relationships or friendships or acquaintances where there may be risk for sexual violence. So this is an area where there are many studies, and some of them, there was a recent intervention called, like I said, Enhanced Assess, Acknowledge, and Act program that has been found to be effective in reducing sexual violence victimization over a year's time. So that's an example of some of the skills approaches. So the strategy with the O is opportunities to empower and support girls and women. This is where we're focusing more on the outer level of a macro level, strengthening economic supports for women and families or women and children, and then strengthening leadership and opportunities for girls. This is trying to get at the outer levels of the social ecology that I introduced earlier. Moving to the P, this is protective environments. This is where you see improving safety and monitoring in schools, like the shifting boundaries example that I gave you earlier, trying to address hotspots in the physical environment of a school or of a community. And I'll talk a little bit more about this later in the webinar about adapting this for the college age. And then in this strategy, there's an approach around workplace policies, applying workplace policies like sexual harassment, having proactive sexual harassment prevention policies in workplaces. And then alcohol policy would be an example for the last one there in green, addressing community-level risks through environmental approaches. And I'll talk a bit more about alcohol policy in a few minutes as a promising area for sexual violence prevention. And then finally, the SV strategy is supporting victims and survivors. So needless to say, prevention doesn't always work, and there are survivors and victims that need to be supported, and we included this for that very reason, to focus on approaches around victim-centered services, treatment for victims of sexual violence. These could be rape crisis centers, victim advocacy, trauma-informed or trauma-focused cognitive behavioral therapy could be an example of treatment, and then as well as treatment for at-risk children and families to prevent problem behavior. And some of these also include sexual offending, and there are example programs like cognitive behavioral treatment programs focused on children with problematic sexual behavior identified early. So those are some examples of supporting victims and trying to lessen harms by identifying them. So I think at this point, it might be a good time to take a few more questions.
Thanks, Kathleen. Yes, a lot are coming in. Let's see how many we can squeeze in this break. Michael Dunn wonders, are there so few effective programs because there really are so few good ones, or because not many have been subjected to rigorous studies?
That's an interesting question. I think it's a little bit of both. There are, as my colleagues' review showed, there are a lot of programs out there. I think this slide said 93 that are those kind of very short, one-time, one-hour sessions that are really focused on awareness. And they may have a goal in increasing awareness, increasing education around the topic, but they're not necessarily going to impact actual behavior, so actual either victimization or perpetration. So there are a lot of programs that are kind of missing the mark on what it takes to be effective in terms of having enough of a dose, having a different approaches to teaching or to sharing the information, getting at the different levels of the ecology, so it's not just individual skills learning. So there's definitely that. And then the other piece is that this is a relatively new area. We haven't had a lot of resources focused on sexual violence prevention. It's a relatively new, and I say new meaning, in the last couple of decades, I think we focused on this. But really, at least with CDC's focus, just in the last 5 to 10 years, we've done more around evaluating programs. And so we're really putting a lot of our sexual violence resources into identifying programs that have some traction in the field but do not have any evaluation, so they don't have any evidence that they're effective, and trying to get those evaluations done so that we can determine if they're effective, so we can add to the list of effective programs. So I think it's a bit of a combination of both, where a lot of programs just haven't been evaluated, and then there are a lot of programs which we probably don't want to waste resources on evaluating because we kind of have a sense that they won't work based on what I shared earlier. So that's a good question, though.
Let me get in one more during this break. We are running a little late. Where do we go to get these programs for our university students?
So one place to start would be our technical package, because it will give you a little bit more information about each of them and the evidence that there is on each of them. And it will have citations in there where you can find the original articles that we cite that provide the evidence, the evaluation results. And some of them are available. It depends on the program. Some of them are available and you can just contact the developer. Some of them there will be a cost associated with it, but many of them it would just be an email to the developer, usually it's the first author of the articles that are sharing the evaluation findings to find out more information. Some of them you can just Google and find, type in safe dates and you'll find how to get access to it. And I can also help with that if you're having trouble identifying it.
Thanks, Kathleen. We'll let you get back to your presentation.
Okay. Now I'm going to move to the latter part of my agenda here, which is focusing on and talking a little bit more about the comprehensive multi-level approach or prevention strategy and why we think this is so important. So moving again back to, oops, I think I missed oops, there we go. So this slide just gives a sense of how sexual violence is not a simple problem. It's a very complex problem. There's a lot of risk factors and factors associated with it. And we know that complex problems need complex solutions. So there's not an easy way to prevent sexual violence. We know that perpetration of sexual violence is influenced by many factors. So there's factors at the individual level that have been identified, family and peer influences, broader contexts like norms and the culture and the social structures in which we live. So because of that, prevention approaches that address one or two of these factors, they may have some positive effects, but they may not have long-term or large effects on impacting the actual behavior of sexual violence because they're not addressing the whole universe of what's related to sexual violence. So going back to the social ecological model that I shared earlier, what we're trying to move towards is the ability to build and implement comprehensive prevention strategies. So what we mean here is strategies that include multiple components and affect multiple settings to address a wide range of all of these risk and protective factors that we've identified across all the levels of the social ecology. So in order to do that, we need strategies that operate at each of these levels. And we're honestly, as a field, I don't think we're quite there yet, but we're moving in that direction. I'll give you some examples of what I mean. So this is an example of how we've tailored the social ecological model to reflect how to address sexual violence at each of these levels. So for example, at the individual level, strategies may focus on learning attitudes and behaviors that support equality and respect. At the relationship level, there may be a focus on bystander intervention or mentoring and skill-based programs at high school levels, in pulling parents into addressing violent attitudes and behaviors in their kids. And then at the community level, there may be social marketing campaigns. There may be identifying those hot spots or unsafe areas on schools or on campuses or in communities. And then at the societal level, here's where we're talking about promoting norms, policies, laws, supporting various things like bystander, skill building, healthy sexuality, et cetera, et cetera. So ideally, these strategies at each of these levels would be known to be effective in preventing sexual violence. We don't always have all that evidence yet, but we have some idea. So this is an example of a comprehensive campus-based strategy that some of my colleagues pulled together as part of CDC's report to the White House Task Force on to protect students from sexual assault. So this was developed a couple of years ago, and it's just more specific to the college setting. And you see these different strategies that may be at these different levels, bystander intervention, healthy relationship skills, coach-implemented interventions, dorm-based interventions. These are just some examples, not all of which have evidence, but there's some brainstorming ideas on how to address these different levels. At the organization level, that could be the campus level, engaging campus leadership, or doing a social marketing campaign, hotspot mapping, et cetera. And at the community level, initiatives to enforce alcohol policy, et cetera. So ideally, once again, all of these strategies would be evidence-based, and we're moving in that direction as a field. But what we know, what I've shared in this webinar, and what we know is that most of our either effective or promising interventions that have been identified out there in the literature are at the individual and family peer level end of the social ecology, and there's little at the community level and pretty much none at the societal level. So what's missing is clearly the community and societal level strategies that we know to be effective. So with that, I want to close out the webinar by talking a little bit about just a couple of examples of innovative projects that are ongoing in the college context, just to give you a sense of where the field is going in some of these areas. So one is around policy approaches, and this is where I'm going to talk about alcohol policy, but some of my colleagues here are doing a larger exploration of policy approaches to sexual violence prevention. So we're exploring different policy areas with the potential to prevent sexual violence. Some of my colleagues have been working on identifying different areas around alcohol policy, as well as workplace policies and family leave and family-based policies and areas like that, with the idea that, why would we focus on policies? Well, one, they could have a very broad impact with few resources. So if we can find out that a policy is effective, it's going to have a broader-based impact on public health than an individual strategy that's just focused on changing one individual's skills or behaviors. Other reasons, modifying the behavior by changing the environment, rather than changing people. And then these policies and areas in this outer level of the ecology can really be a complement to change that we see at the individual and relationship level. So again, we see this as part of the comprehensive approach. And one, as I mentioned, one area is alcohol policies. So why focus on alcohol policies? We kind of feel like this is low-hanging fruit. We know that there's already been an established association between alcohol and sexual violence in the literature, and there's been some connection to other forms of violence as well, including delinquency, assault, and homicide, physical assault and homicide. As I said, the relationship between alcohol and sexual violence perpetration is clear in the literature. And we really see alcohol as a risk factor, but not a cause or an excuse. So it's not victim blaming if somebody drinks that they are creating, or causing violence. We don't see it as that way. We really see focusing on alcohol policies as addressing alcohol in a way that's not victim blaming, because it's focused more on the broader context and the policies and the communities where alcohol exists, rather than focusing on individual use or abuse of alcohol. So that's a little bit about that. And what we found what we found in the literature around alcohol policy is there are some areas in terms of potential impact on violence, some areas that we feel are really ripe for more research and some evaluation, and then some areas that may hold some promise. So areas that we feel are ripe for evaluation are pricing strategies and outlet density. So the price, how much alcohol costs, has an impact on sexual violence, or at least it's been found to be related to sexual violence, because increasing the price leads to less drinking because people can't afford it. Outlet density, how many alcohol outlets you have in a particular area has been associated with the amount of rape in that area. So there has been some association kind of empirically and ideologically between these types of policy approaches. So it's really an area that we're trying to explore more. And then there's just more research needed on some other areas like college policies such as substance-free dorms, the sale time of alcohol, drinking environments and responsible beverage services, and then alcohol marketing. That's just an area that we're hoping that more research will be done. And there's an article there at the bottom that will give you more information. And then moving finally, actually, this is the next to last one if we have time. Bystander program adoption and efficacy to reduce sexual violence and intimate partner violence on college campuses. This is what they call the McBEE project. It's a multi-college bystander efficacy evaluation. This is looking at 30 different colleges across the U.S. to try to increase bystander efficacy and behaviors and reduce violence acceptance. This is a longitudinal study over time that is kind of framed as evaluating the Campus Save Act, the federal policy that requires all publicly funded colleges and universities to implement, among other things, to implement bystander intervention programs. So this study is trying to identify what components of bystander programs are the most important. So in other words, any college can do a bystander program, but we don't know if all the bystander programs that are being used out there are effective. So this study is trying to identify which components of the bystander programs are most important and have the most potential to reduce sexual violence, so that maybe it can inform the policy around what bystander programs are actually required or recommended for this to be in line with the SAVE Act. So that's just to give you a sense of that. That's ongoing research, and we won't have findings for a few years. And then finally, the Shifting Boundaries College Adaptation. So Shifting Boundaries was the study I told you about earlier about middle schools in New York City, where they're looking at hotspots and different aspects of the physical environment of the school and how they can change that to decrease sexual violence. Now there are a group of folks who are looking at adapting this intervention for the college context. So this is a collaboration of many highly experienced experts in this area. So it's being administered by the Center for Effective Public Policy, and they're in partnership with CalCASA, with the NSVRC, with the Applied Research Services, and then the University of Michigan and Wellesley College Center for Research on Women. Nan Stein was the original developer of, the chief developer of the original Shifting Boundaries. So these folks are working together to look at a college adaptation that has several objectives and pieces to it. So they're going to do a scan of college campuses. They're going to do site visits. They're going to develop an adaptation of Shifting Boundaries for the college, and they're going to draw upon the foundation of the original interventions and take into account the differences across college and university settings. Then they're going to pilot those interventions in some demonstration campuses, and then eventually implement monitoring and evaluation of this and develop and disseminate resources for the field. So this is a long, ongoing process that is at the early stages. And I just wanted to note, it's important to note that this is all preliminary, what I'm sharing now. The project's in an early stage. There will be situational interventions that will be tailored for each university, so they expect that it may look different for different universities, and they will, they're treating this as a pilot, so they will have some lessons learned from the initiative. But the large hope is that they will develop some kind of a flexible adaptation of Shifting Boundaries for the college setting. So I wanted to just share that this is coming, but it's going to be a few years before it's out. So with that, if there is any more time for questions.
We do have a couple more minutes, but I see that your email address is there on the screen, and you offered to follow up on a couple of the previous questions, so perhaps they'll apply to these as well. Okay. Someone says, I struggle with having students attend multiple sessions or modules. Do folks have any suggestions for how to encourage students to attend? For which there was a reply, food is a good option to have students to attend, but also have them receive certification would be a good idea. And then another follow-up, maybe trying to team up with a required general education course to take over parts of a couple of classes. And then finally, at our college, in order to sign up for the next semester, you have to have certain webinars completed before you can enroll. So a whole bunch of ideas there. Do you have any comments on that?
Yeah, I think those are all good ideas. Some universities, and I think this varies quite a bit, but some universities require some of this. I know there's alcohol interventions to prevent alcohol abuse. There's interventions around sexual violence that are required as part of the freshman orientation. This varies by college, but I think the point I would want to make is that it needs to be more than just that freshman orientation dose. Like I was talking about earlier, 1 hour awareness at the beginning of freshman year is not going to be enough. It needs to be sustained over the course of the college career, really, with repeated doses and different interactive ways to present the information, and ideally evidence that it's going to be effective for the sample, for the age and the college level that you're focused on. So yeah, it is a challenge. It's a challenge in middle schools and high schools as well to try to get this kind of content in. If there's any way to bring it in with something that's already ongoing, that's already a requirement and kind of connected, like I think some of the suggestions were, I think that makes a lot of sense.
And there are a couple of other comments related to the brief sessions that you were talking about. Let me give you a couple to see if you have comments. When you mention brief one-session interventions, are you referring to similar 2 or 3 day programs that failed to include a building-level intervention, i.e. one session meaning a one-off with no follow-up? And on that same thread, are there common examples of the one-session educational awareness programs that we should avoid as we do this work on college campuses?
Well, the second part of the question, if you look at the Degue et al. Paper, D-E-G-U-E, Sarah Degue was the lead author, and the citation is on one of the earlier slides. They have, I believe, a very comprehensive table in that paper that identifies what programs they looked at and whether or not they were effective. So you may want to take a look at that to identify the ones that are effective as well as the ones that you may want to avoid or you may want to consider evaluating before you use them because they may not be as effective. And the other earlier piece of the question I've forgotten.
I think the point there was whether it was the length of the session, brief 1 day versus 2 or 3 days, or the lack of follow-up afterwards.
Yeah, I think it's probably a combination of both. I mean, if it's a short session and there is no follow-up, then it's not going to be sustained. There may be, post-test effects on changes in knowledge or even behavior, but it may not be sustainable. It's, once a few weeks have gone by, it's gone. So I think the dose is really important. There's a paper by Nation et al. If you look at Nation, N-A-T-I-O-N, they have principles for prevention, and there are a few things besides dose that you should consider. Dose is one, having theory to back the intervention, that it makes sense theoretically and conceptually. Also, like I said earlier, the different ways of sharing the information, not just teaching to a student where they're passively listening, but having interactive, some of the evidence-based things have had like poster contests and different things where there's interactive student involvement. So that Nation et al. Article may be useful in identifying some other areas that you need to think about for prevention.
Thanks very much, Kathleen. Thanks to all of our viewers and questioners from around the Internet. Check the NCCPS webinars page for a link to the captioned recording of today's presentation, as well as a link to our speaker slides. The brief evaluation survey I mentioned earlier should already be in your mailbox. It will take you more than 2 minutes to complete. Please do. We read and act on your comments. Mark your calendars for our next Campus Public Safety online webinar, 2 to 3 p.m. on Thursday, November 17th. Our speaker will be Kim Richmond, inaugural director of the National Center for Campus Public Safety. She'll be discussing where we are and moving forward together. The registration URL is on your screen and clickable, or surf on over to the National Center webpage at nccpsafety.org. That's nccpsafety.org. The National Center for Campus Public Safety is bringing our extremely popular Trauma-Informed Sexual Assault Investigation and Adjudication Institute to a number of locations from coast to coast. The curriculum includes modules on 15 topics, from the effects of trauma to a multidisciplinary approach to investigations developed by subject matter experts in the areas of psychology and culture, sexual assault investigations, Title IX, and Clery. The schedule for upcoming dates is on your screen. For more details and to register, click the blue link or visit our webpage. Campus Public Safety Online is brought to you by the National Center for Campus Public Safety with support from the University of Vermont Continuing and Distance Education and the U.S. Department of Justice. Special thanks today to Alex McAtee and Kim Richmond. This is Steve Worona. See you next time on Campus Public Safety Online.